I'm Audrey Norby, and I'm a genetic counselor. The primary roles of a genetic counselor are to provide information, resources, and support to patients. There are a lot of reasons a patient might speak with a genetic counselor at the Fetal Diagnosis and Treatment Center. We discuss with patients risks associated with maternal age, exposures, family history, and abnormal ultrasound findings. We review from a genetic standpoint which of these risks apply to the patient and her pregnancy. We also discuss testing that might already have been performed, such as blood testing like the quad test, or more invasive procedures such as CVS or amniocentesis. We review the meanings and implications of this information and discuss with the patient further testing options that might be available just given her situation. Together we discuss the risks, benefits, and limitations of this testing and help the patient make informed decisions to determine whether further evaluations, especially genetic testing, are appropriate or something she would wish to pursue. If a diagnosis has been made for a pregnancy, it's our role to make sure the patient understands that diagnosis. We review details of the condition, including typical features, treatments, and the cause if known. One specific piece of information that's important for patients to know is the chance of the same thing occurring in a future pregnancy. We make sure to review the inheritance pattern of the defect or condition and discuss how to reduce the risk of recurrence if that's possible. Genetic counselors serve as contacts for patients as well as healthcare providers for questions regarding risks and testing. We provide resources that are pertinent to each patient's situation, including literature about a diagnosis, support group information, or contacts for other resources or healthcare providers that might be beneficial to the patient. Genetic counselors, as part of the Fetal Diagnosis and Treatment Center team, use our knowledge of genetics as well as counseling skills to help patients understand information about their pregnancies and provide support and resources specific to their individual needs.